The doctor has now ordered for patient in room 1 IV needed that to administer clofferin 560 milligrams IV Piggy Back every 8 hours. And we're going to place that in 50 milliliters of NS to infuse over 45 minutes. And we're going to give 4 doses of this. So I'm actually just going to mix the solution right now and inject it into the NS Piggy Back. So I'm going to make sure I perform correct hand hygiene, washing my hands, do the 6 patient rights, right patient, right med, right dose, right route, right time, and then documentation. I'm going to also make sure my patient doesn't have any allergies to what I'm mixing up. And I'm going to then make sure that all of my medications are the correct ones needed and that there is no cracks, nothing is expired, and that there's no floaties in any of my supplies. All right, and now that everything is ready, I'm going to start to prepare the solution. And I'll make sure to maintain sterility. And I'm going to start by injecting 5.6 milliliters into my powder, and that's going to give me 6 milliliters of solution altogether. So I'm going to take off my cap, and I'm going to alcohol the tops of each one. And then I will draw up my medication, and I'm going to open all of these. If I would have touched that, I wouldn't have done that. I would have added and then I'm going to draw up the 5.6 milliliters, and I'm going to switch my needles. And so I'm going to switch my cap so that I can drop my 5.6 mils. And I'm going to insert the air into this one, making sure not to create any bubbles. And then I'm going to flip it over, making sure not to get any bubbles, and I'm going to withdraw my solution, 5.6. All right, and then I'm going to then add the 5.6 mils into my powder, making sure if I feel any resistance, then I let up and let it breathe. All right, and then I'm going to make sure that I cap my needle because I'm going to use it again. And now that I have my solution made, I'm going to gently roll this around, making sure not to shake it, but making sure that everything is dissolved. And then while I am doing this, I'm going to make sure that I have my medication added form filled out with the patient's name and the drug and clofferin that I added 1.8 milliliters to my NS solution. So now that this is all mixed in, I'm going to have my needle and put it on my syringe that I'm going to draw up to inject into my bag. Once again, making sure that I have the right solution, that it's not expired, that everything is up to date. And I'm not going to inject it where I'm going to put the spike. I'm going to take off or cleanse the port. Alright, so I have my bag and now I'm going to drop my 1.8 milliliters of solution, and that is going to give me my 560 milligrams that I need to add to my bag. So I'm going to make sure that I take my alcohol swab, I'm going to cleanse the port again, and I'm going to add my 1.8 Any resistance, I am making sure that I let it breathe. I'm then going to draw up .8. All right. And so I have my 1.8 drawn. I'm going to insert it into my bag. I've already cleansed the port of this, making sure not to poke through anything. All right, and I'm now going to inject that into my bag. And I'm going to immediately put on my safety, and I'm going to dispose of this into the sharps container. And I'm going to take my label, and I'm going to label with what I had said earlier onto the bag, making sure not to cover up what the bag is actually on there. All right, now that that's done, I'm going to label my vial with what I added, how much is in there, make sure that it's labeled with how long it's good for, the start date and time, and is on there. And then I'm going to start my IV Piggy Back. I'm going to get my secondary medication set right here. This is also a 10 drop factor. And I'm going to open this to set it up so I have it ready before I go into the patient's room. And when I hang my IV Piggy Back, I'm going to make sure I hang it higher than my first bag, and that's going to make it the primary. And here's a little attachment that is actually going to hang the first bag lower than that one. So when I go into the room, I'm going to attach the NS bag to the hook here. So I'm going to prepare this, and when I get to the room, I'm going to set the IV drop factor again. I'm going to remove my cover, and I'm going to cleanse the port just to be safe. And I'm going to take off my spike, making sure not to touch anything, and I'm going to spike my tubing. All right. Now I'm going to make sure that this, and I would make sure that my tubing was closed before I had even spiked this to make sure that there was no leakage. I'm going to squeeze this to make sure that there is the halfway. All right. Now that that is set, I'm going to check for air bubbles. If there's any air bubbles, I'm going to make sure I slowly open the port and remove those. Making sure, though, not to let out any medication that is needed. All right. And I'm going to document the, and so once I have documented, I am now going to go to my patient's room. And once I go to the patient's room, I'm going to make sure that I introduce myself, wash my hands, explain the doctor has now ordered a new order, Clofferin 560 milligrams, and I'm going to then add that to his IV. I'm going to wash my hands. I'm then going to put my gloves on just to maintain a sterile field while I do this. And my drop factor is, I'll have to assess that when I attach it to my bag. So I'm going to stand up. So I'm going to now adjust my bags for primary and secondary. I'm going to take the hook and I'm going to attach it to my first bag and make sure that I have the tubing labeled. And I'm now going to hang my Piggy Back at the top, and then that is now my primary. I'm going to set the drop rate for that one to 11 drops per minute, which is approximately 3 per 15 seconds. So I'm going to then assess my drop. So I'm going to then connect my primary to my secondary tubing. I'm going to cleanse the port, and I'm going to attach this. And I'm going to set my flow rate. I'm going to check it for 3 mils per 15 seconds. So now that I have my primary bag, the one that I added the medication to, set at the drip rate of 11 drops per minute, 67 drops per hour, I am going to now see that this is completely infused, and I'm going to now detach this to make my first bag the primary once again. So I'm going to take this off and dispose of this correctly. And I'm going to establish my drip rate once again with the first bag that is now primary, and establish that back to 7 drops per minute. 7 drops per 15 seconds, which is going to give me 28 drops per . All right. And now that I have that done, I'm going to check to see how my patient did when I was administering the first medication. I want to make sure there's no redness, no kind of allergic reaction happening, that the patient is taking all of it okay. I'm going to go document, and this whole time I would still make sure that I have the 6 rights: right patient, right med, right dose, right route, right time, and then document.